Assalamualaikum and salam sejahtera. Hi there, I'm Dr. Mariati. Today I'd like to share with you a chapter 12 regarding fabrication of removable appliance. At the end of this session, you are required to know about the learning outcomes of fabrication for removable appliance. The first one is describe appropriate prescription and design of a removable appliance using a laboratory form. Second learning outcome is discuss the criteria and storage of impression for working model. Describe the working model. List the sequence of procedures for construction of a removable appliance. Removable appliance is designed to carry out limited tooth movement. It is relatively simple to use and generally well tolerated by patients. It can be used very effectively to correct minor occlusal problem. Design of removable appliance is based on the intended types of orthodontic tooth movement, with emphasis on the retention of the appliance. A design is written and to be drawn using a standard laboratory prescription form. These are the laboratory form as highlighted on the right-hand side. These are the detail of prescription form that need required to have. The first one is patient details. Name and registration number should be included. The clinician details such as name, contact number, and their signature should be provided when there is submission of the form. The date of submission and the date of required is also important. It will give a highlight to the technician of the duration that the appliance should be ready and to be issued to the patient. Practice details, which is name and contact number, is necessary to allow the technician to contact the clinician if there is any queries or question pertaining to the appliances. Design of the appliance will include the instruction, prescription, and drawing based on Arab concept, which is active, retentive components, acrylic, and base plate. The prescription should be written in details, which highlight on the active and retentive component, which include the types of wires and the gauge of wires to be used in the appliance. Detail of the technician and laboratory, which includes their names and contact number, will facilitate the clinician to contact them is necessary. Impression for working model. The alginate impression is the type of material that we use, which is a reversible hydrocolloid impression material. It is widely used in orthodontics. The impression is kept damped in sealed polythene bags. It is well packed and packed to avoid distortion and damage during transit. Impression for working model. It has several criteria for acceptable impression. The first one is the impression tray is centered over the central and lateral incisors. The tray is not overseated, which means that there is no exposure of the area of impression tray seen. The impression also is free from tears and voids. There is sharp anatomic details of all teeth and soft tissues. The retromolar area, lingual frenum, tongue space, and malohyoid ridge are reproduced in the mandibular impression, while the hard palate and tuberosities are recorded in the maxillary impression. Let's move on to the wax bite. Wax bite is necessary to register the occlusal relationship of the patient. It should consist only a bar of moderately softened wax across the premolar area. When the teeth are fully closed, the molar will be in contact and the working model can be easily be brought similarly into contact when registered in the wax bite. Next is working model. Working model is highlighted in the photograph, will be trimmed and cast to facilitate the fabrication of removable appliance. Here we also included videos for you to have some overview regarding the trimming and the preparation of working model. Next is construction of removable appliance. Here we highlight to you step by step of fabrication for removable appliance. It will begins with inspection of working model, creation of undercut if necessary for a component such as arrowhead of Adams class. Altered area will be painted with a mold seal or separating material. All components will be placed on the model and secured with flowing wax. Small cut on the plaster model is necessary to sit a component such as screw tab. It will be securely positioned on the model. Next, use of wax to prevent acrylic flow to the unwanted areas. Model will be positioned at angle during the construction. Building of acrylic base will be based on the application of polymer powder and liquid monomer, which is known as salt and pepper methods. Building up the thickness of base plates may be required. Acrylic material can be extended to form anterior or posterior biplane, followed with placement of the model on the warm water in the hydraulic pressure flask and left to cure. The appliance is removed from the working model, then it will be trimmed to shape, smooth and polish. Here we have two videos for you which highlights on the application of salt and pepper methods, followed with the step-by-step fabrication of removable appliance. Enjoy. We end this session by giving you an assessment which to test your understanding regarding the fabrication of removable appliance. These are the questions. Some reference for you. This is to enhance your knowledge and understanding regarding to this topic. With that, I thank you.